start from KATH, where patients who require laboratory tests have been left stranded at the Komfo-Anokye Teaching Hospital at the start of a sit-down strike by laboratory scientists there. The health professionals are protesting the appointment of 2 medical doctors to the Laboratory Services Directorate. Many patients who needed laboratory services were helpless, with some seeking services outside the hospital. My colleague Ohimenteria has been monitoring the impact of the strike, and there's more in the following report.
The over 300 medical laboratory scientists are not happy with the decision by managers to post 2 medical officers to the directorate. They insist the appointment of the 2 is intended to sideline its members qualified for the position. Members say they will continue to withdraw their services until the decision is reversed. Some of them were seen idling about in the presence of their disappointed patients.
Since they are saying they are going on strike, it means you have to wait till they resume, so that if you're able to get our results, you can send it to our respective doctors who are supposed to take care of it.
Many patients seeking laboratory services were left stranded. The laboratory scientists, laboratory technicians and laboratory assistants, however, say they are concerned about the impact of the strike. Ernest Bedu is chairman of the Komfo-Anokye Teaching Hospital branch of the association.
I'm not a happy man, because if I am happy with what is happening, probably this strike would have happened 2 years ago. We are not happy because we decided to dialogue for good 2 years, but management, the ministry did not heed to our call. That's what has brought us to this stage today. So it's an unfortunate situation, yes, but we pray that even as the strike is in its early hours, the authorities, the ministry will come in and resolve matters for us so we can quickly resume work and stop this needless inconvenience and needless patients going around searching for a place to do lab tests. All these things could be brought to a halt if management and the ministry could act on this matter and resolve this matter holistically.
Mr. Bedu blames management of KATH for the outcome of the impasse. According to him, management downplayed the threat from the association.
We are always seen as the weaker point or the underdogs, because laboratory has always been seen as a place where doctors can easily colonize. And so when we back, it's like we are treated with disdain. We are treated as if we can't act on the issues that we have raised. So based on that, we also have to show management that yes, we don't just talk in vacuum, but we are ready and we are resolute.
Meanwhile, authorities at KATH say the hospital is reeling under the impact of the strike. Public Relations Officer Kwame Frimpong speaks measures to mitigate the impact.
Definitely, if you have your in-house medical laboratory scientists going on strike, definitely will be affected. And if even you put in alternative measures like we are doing, it will not be as rapid and as effective as if you have your in-house team working 24/7 as they used to be. But this is a crisis and we are doing everything to mitigate the impact. There are some contingency measures to provide some level of laboratory services for our patients. Enough arrangements are being made, and it is hoped that very soon the hospital will be able to serve the numerous patients who come here as far as laboratory services are concerned. In fact, arrangements have already commenced, and we are in talks with some partners, including hospitals and private laboratory service providers in the city, so that we can put in a system that will ensure that samples that are collected at a hospital are processed by these partners.
From Kumasi, for Joy News, Ohimenteria reporting.
The Ministry of Health is meanwhile asking the laboratory technicians to call off their strike. Head of the Health Desk, Fred Smith, here at Joy News, joins me with a copy of the statement. Fred, what exactly does the statement say? Kindly unmute for me, Fred.
Yes, Aisha, as you know, the strike has already started biting. The ministry is concerned about the discomfort some patients have started experiencing so far. And so they've issued a statement calling for calm. And I present to you what the Chief Director, Kwabena Boadu Oku Afere, has been saying in this statement. And it says that the ministry has noted with concern and has taken charge of the issues raised and is taking the necessary measures to address them appropriately. A stakeholders meeting will be convened by the Ministry of Health within 3 weeks to adopt a roadmap for a final resolution of this matter. And the medical laboratory scientists have been requested in this letter to submit their memorandum to the Honorable Minister by Thursday, the 27th of May. And the ministry is also urging all parties involved in this, particularly the Komfo Teaching Hospital chapter of the laboratory scientists and the Komfo Teaching Hospital chapter of the Doctors Association, KATH, to stay away from any industrial action and to continue with their invaluable services to the general public. And they've also been advised to remain calm whilst the ministry seeks an amicable solution to this matter. And the health minister himself, according to this statement, is leading the discussions or negotiations to resolve the concerns.
Head of our health desk at Joy News, Fred Smith, with that statement.